I was born in Venezuela, and that's Venezuela. That's my little town where I used to practice medicine. And I try to use it as my opening slide because it reminds me, really, why I am doing what I'm doing. That's rural Venezuela. The name of that town is San Antonio del Golfo. It's very poor. It continues to be poor. 80% of the people in Venezuela are poor. And we have more of the same. We can, if you want to know about Venezuela, we can do an open space this afternoon. When I was practicing medicine in Venezuela, one of the most frustrating experiences was to see the same kid over and over with a different diarrhea every week. And to see tuberculosis and people, and then to see people without water, without this, and things that we take for granted. And same diseases, same thing, 85% of the things that I used to see were the same thing over and over. And one day I said to myself, that's not what I want for my life. I don't want to be seeing the same kid with a different diarrhea every week. That's not what I want. But I also was seeing something very good in Venezuela back then. I was in charge of a team of people that were called community health workers, or promotores. Promotores is the word in Spanish. And these community workers were people from those towns, people with high school education or less, with a training that were able to actually prescribe and take care of a lot of situations in those remote areas in my rural Venezuela. And it was unbelievable to see how they could have all the kids in town immunized using a system with a shoe rack and index cards that were created with cardboard from boxes from Tide the powder. So you had a list of cards, Pedrito, Luisito, Mario, Juancito. And these promotoras would go house by house, knocking at the doors and asking people to bring the kids forward. Tráeme a Pedrito, tráeme a Luisito, because he's due for his vaccine. And then the interaction with the families in the town. The parents would say, well, he's sleeping. And the promotora will say, well, I really don't care. Bring Pedrito because he's due for the vaccine. Pero está durmiendo. I really don't care. Bring me the kid. I'm busy. So, it was like this, I'm your comadre, I'm your neighbor, and we had fully immunized towns. But I work in Orange County where you have a lot of technology and you have even a Mickey Mouse there. And we have a lot of kids without vaccines. And you can think about this and think in many factors that are influencing these outcomes. But I decided to believe in one thing. I decided to believe that what makes the difference in the health or the advocacy or in putting pressure in institutions to change things was your ability to participate. And I think that the most important behavior that we need to encourage people to develop is to participate. Now think about it. The World Health Organization talks about primary care and the Declaration of Primary Care of Alma-Ata, in which they said that the majority of the people in the world do not have access to services. And they also said in 1978, in that declaration, when they said health for all in the year 2000, they said that the most important worker that we need in order to improve access is a community worker. And they say that because it is the community, the one that has not only the responsibility, but the real power, even if they don't know it, to change things. So the World Health Organization also talks about healthy cities, which is the model that we embrace in Latino Health Access. People talk about healthy cities and they say, I want to live in a healthier city. I want to have a healthy city. But what is that? That could be just a conversation between you and I, or could be a framework that guides policies and programs and strategies. So Healthy Cities actually is a strategy and is a framework that has principles and steps and components. And one of the main components is that you cannot have a healthy city unless you put together different sectors on a table. And those sectors come up with a plan of action. And those sectors include, the people that are doing business, and the people that are doing education, and the people that are doing healthcare, and many others, including the community. Since this framework started going around the planet, the member that has been absent in that table has been the community. Because the mayor of that city in Liverpool, where this model was very popular and continued to be, well, the mayor gets paid to be in the table. And the people from the city and the people from the college also, they go to the meeting and they still get paid. But the community members do not get paid. And in order for Mrs. Martinez to go to a meeting, she will have to stop one day of work, which means the food of her kids. So for her, it's a luxury to participate in that type of event. Think about this conference. There are people downstairs with their computers drinking coffee, watching me, hello, watching me, because the people that put together this conference thought, how do we make them participate? They are busy. They need to send emails. Well, we're going to put a room for them so they can send emails and participate at the same time. Well, how convenient. But for the community, that doesn't work like that. We don't say, okay, let's get the farm workers. We are going to get a room for the farm workers while they pick a strawberry. They can also participate in this healthy city strategy. So it doesn't work. So the more and more I got involved into this, I realized that the community is not going to be involved. It's not going to happen unless we purposely design mechanisms for their inclusion and their participation. It has to come like that. So, and if we don't do it, what happens is that we get a bunch of policies that are approved that nobody implements in my community. We get laws we get issues of housing that shouldn't be happening, but they happen because our community doesn't have a voice. It's very disorganized. They don't know their rights. Many of them are immigrants. Many of them do not have documents. Many of them are very afraid. Our communities are disconnected. The city is very imbalanced, pays attention to the people that give money for them to be reelected, and we don't count. And we will not count unless we participate. So Latino Health Access decided that we want to improve participation so we can have a change that we own. Because we talk about change and this momentum, I do believe in change, and I'm very hopeful, I'm very optimistic, but I think that change requires for people to think and for people to engage in action. What we are doing here is a luxury. So we need to somehow figure out how we invite communities to think and to have the time aside to create the space for Mrs. Martinez y el señor Rodriguez and the people that make tamales and the people that clean houses to think. Otherwise, we continue to focus on issues that are great and are very successful. When the issue is gone, people are gone because they are not in here to transform their lives. They are here to just solve that issue. We are here to solve many issues. We have learned how to participate. That's why we are here. And we believe in this, and we believe in changing the nation and the world. But many people just think about how to get food on the table. So this is a little bit of what we have done. Okay, this is about Orange County. This is my team, part of my team. We employ people from the community. They are, again, called promotores. People that have diabetes and are in charge of the diabetes program, people that have been victims of domestic violence and now they run our strategy against violence, men that were in drugs and now they are teaching men the honor of respecting and healing their communities. We have elders reaching elders. We are teaching immigrant women how to read and write so they can really practice the role of leadership that they deserve.